would you do if your hand surgeon told you the only treatment available for your condition was to cut open your hand, finger and palm, and that it would take 3 months to heal, that you would need physical therapy, and the condition might return? Then you pay a visit to Google, and out pops an alternative treatment with no cutting the hand open, a 2-day recovery period, which is 10 times less expensive, and a better track record of solving the problem. I wrote to the surgeon 48 hours after receiving this alternative procedure. I offered to show him my hand so that he could see the results, but he ignored my offer. So what next? You might decide to complain about the hand surgeon. The mission of the Florida Department of Health is to promote, protect, and improve the health of all people in Florida. The Surgeon General, Dr. Anna Viamati, commits the department to act on behalf of the people for the greater good and to be accountable and credible to those we serve. Based on my experience, I can tell you what would happen if you decided, as I did, to complain to the Florida Department of Health. You need to find a simple 3-page complaint form hidden on the 3rd layer of their website, which is not recoverable using their search function. Once you do find it, you fill out the form, including a release of information page that entitles the department to access your medical records. You put it in the mail, you wait for a reply, you receive an answer, you read the letter. We need your medical records from the surgeon. According to Florida law, the patient is entitled to a copy of the patient's records. The Department of Health will not assume responsibility for the payment of these records. If we do not hear from you within 30 days, we will take no further action. That can't be correct. They already have my signed release of information, and my records would have no bearing on whether the surgeon, A, did not know about the alternative procedure, or B, knew about the procedure and wasn't telling his patients. Either way, it's a violation of accepted medical standards. So, I called the Department of Health. So what you wanted me to do was to send him a certified letter, get the records from him, and then send them to you. Is that right?
Yes. I mean, in order to make the determination, we do need the records. Yes.
Now, as part of the complaint that I filed, I signed a release of information so that you could access any of my records.
Right.
So why are you asking me to do this?
Because before we send it to the field for investigation, we need to determine legal sufficiency. And in order for us to determine legal sufficiency, you have to provide the records too.
But given what I gave you, my records won't have any bearing on that. So it would seem that he doesn't know or wasn't keeping up on a treatment within his field of specialization. So, you know, there's nothing in my record that would show that one way or the other.
Well, we still need the records.
Mm-hmm.
I mean,
the record doesn't bear on whether he knows anything or not, whether he knows about that procedure.
I don't know how to explain this any better to you than I'm explaining out. We need the records to determine legal sufficiency. If you provide the records, then your case is probably going to be opened up. I mean, I can't guarantee that because I'm not a doctor.
So, now you need to write the surgeon and ask for your records. Put it in the mail, wait for a reply, receive your records, attach the records to the health department form, put them in the mail, wait for a reply, receive the answer, and read the letter. Thank you for submitting your complaint to the Consumer Services Unit of the Department of Health. Our medical consultant has reviewed your complaint. We have determined from the review that the above healthcare practitioner has not violated the laws or rules that regulate his or her profession. Therefore, no further action can be taken. Now I get it. The Department of Health is part of the problem. Florida is one of the 4 highest levels of cost and one of the poorest levels of quality of health care in the country. The 2009 Dartmouth Institute report on health care spending, quality, and outcome compiled the findings from Medicare records. And when you are all done with this complaint procedure, you will be asked to fill out a multiple-choice survey about your level of satisfaction with the department's services. Or you could just make a YouTube video like I'm doing and send it to the health editors of Florida newspapers, all your friends, Facebooks, Twitter, or whatever. In the current healthcare debate, everyone is concerned about improving the quality of healthcare and cutting costs. But when you have a real-life case example of how it could be done, the biggest challenge is to find anyone to listen.